Some things we can do in preparation for 2026. We're preparing for 2026. You know, I'm in the headline, so I'll give some health tips, health advice. One of the things I want to quickly talk about is health insurance. If you are qualified for health insurance, that's the NHIS, National Health Insurance, or National Health Insurance uh, Agency, NHIA. If you are qualified for insurance, if you work in with the government, if you are working with the government, the formal sector, you are qualified for NHIS, to enroll for it and to enjoy the benefits. If you are working in private sector, and if the private sector, if it has a number of employees, you know, they should be entitled to health coverage. So if you are working in a sector and you are entitled to health insurance, please go out and register for it and enroll for it to enjoy the benefit. I've seen in the hospital, I've seen people who are qualified to be on insurance who will come and still be go to the section of the hospital where you still do pay, where you still do out of pocket payment, which is unfortunate. Military personnel, armed forces, the police, the army, navy, customs, immigration, the armed forces, the paramilitary forces, they are all under federal government and they are all entitled to NHIS, health insurance. And then I'm surprised I'll see sometimes I'll see some police officers, I'll meet some military personnel. They'll go to sections where they pay out of pocket. And I ask them, are you not, you are entitled to NHIS now? Then they are entitled to having insurance, and some of these things will be paid, be covered. And they'll tell me they have not registered, they've not had time, they say they don't have enough drugs, all those kind of excuses. A number of them have encouraged them that please, what you are being paid, is not, you always complain that your pay is not enough. And now there's health insurance. One of the things that takes money from the pockets of a worker in Nigeria is health cost. You know, out of pocket payment takes a lot of money. So if you are entitled to any insurance, you register for it. Register for it. Register your spouse and 4 children if you have them. Then if you have more than 4 children, there are extra payments you make for you to get them registered and all that. So if you are working with government, if you are recently employed or if you've been employed for long and you have not registered for your health insurance, please do register. The process of registration and for you to be properly enrolled, it takes some months. They've tried to reduce it. It should be 6 months. I think it's shorter than that now. But we have to start the process. The essence of health insurance is for you to have a cover before you get sick. Don't wait until you get sick before you register for your insurance, because by the time you get sick, it's already too late to get covered, because there is a process through which you will enroll. There's a waiting time through which it will be approved, and then for you to get a point of primary care, and all that. So insurance is something you do before you get sick. That's the essence of insurance. So that when you eventually get sick, you have something that will cover you, you know, and all that. So please, if you're entitled to health insurance, ask wherever you're working, either private or public. One of the things you do, ask what's the process of registering for insurance. Then you register, you enroll, get all your papers, all your documentation, so that you can be qualified for it and you can benefit from it. And so that when you are sick, when members of your family who are enrolled are sick, they could benefit from it. I've seen now they've improved. NYC is being covered by NHIS. I see now that more and more coppers, are taking advantage of it and coming to the hospital. In the past, I've seen some that will not register and they will still be making out of pocket payment. You know, I'll tell them that no, you register, you know, register for it. And then if there is a waiting time, if let's say you come to the hospital and ask to wait, you take excuse from wherever you're working and you wait, you follow the process, at the end of which you get medications and you get some appropriate testing done. So wherever you are, whether you're a copper or whether you're working in government or working in private, always ask what is the process for health insurance, what's the process of registration for it, which hospitals are available for coverage. Always ask these questions and do them on time, so that it's not when you get sick that you start running around. You do them early enough so that when you need the services, you can get it. So that's one of the first thing. So for 2026, if you are qualified for health insurance, please do go and register for it. Another thing is, there is some aspect of self-care. Some things you can do for yourself. One of the things you can do is to get some basic equipment, especially when you have gotten to a certain age, you know, and some of these chronic illnesses are creeping in. There are some items you can get that can help, you know. So let me um, bring some of these items. Okay. So this one is Fig. Hmm? This is a digital Figmo manometer, something that we use in checking blood pressure. You know, you can get one at home where which you can use by yourself. You know, all you just need to do is to take it to the hospital when you are seeing health personnel and let them teach you on how to do it properly. You know, in another section, I will demonstrate how it can be, you can use it yourself. This is my own personal one that I use at home to check my blood pressure. Even though I'm a health personnel, but it is good for me to have this thing, my own at home. So this one comes with batteries, that you can put the batteries and use. Then this particular one comes with a point of you can connect a USB cord to it, like the normal Android charger cord. You can connect it to electricity without battery. You can use it. And this one, when you apply it properly, it has a volume uh, control. There's a when you first when you've tied it, once you put it on, it will make an announcement. So you can adjust the volume to raise the volume up or down. If you raise the volume up, then you hear the announcement from it. The voice inside will tell you what and what to do, and you will not talk while the BP is being measured, you know. Usually there are certain things you should know, you know, like 30 minutes before you check your BP. There are certain things you shouldn't do exercise 30 minutes before it. You shouldn't take coffee or stimulant 30 minutes before it, then like few minutes, let's say at least 5 minutes before you check it, you should have rested. You sit down and rest, possibly without talking, and rest for like 5 minutes, then you check it. While checking it, you shouldn't talk, you shouldn't be moving around, you just stay calm, you tie it appropriately, then you put it on, then it will now measure it. At the end, it will now announce it. It will tell you the value of what you got. And this one comes with a color code. We have the green color, the white, we have the red. The green color shows your BP is okay. So when the figures come out, if it's green, it shows your BP is okay. The white is this one. Sorry, this one is yellow. Sorry, because of my glasses, dark glasses I'm wearing. This one is yellow. Yellow is borderline. Then red means is high. You understand? So when it's showing red, you know that you need to really seek medical attention. When it's showing yellow, it also shows that you need to see medical attention as well. But red is danger, you know, but green. So, and you hear the announcement from the voice in this, the BP device, the digital device. The voice will tell you if your BP was okay and if it's on the high side and all that. So this is a very valuable tool to have. So as you are planning for things for 2026, you can also get a fig like this. It's not too expensive. At the time it was around 20K or so, you know. But I don't know the cost now. It will have risen higher than that, but it shouldn't be too costly. It's something that once you get it, you know, you can use it for long without it getting spoiled, especially if you are using it alone or you are using just within the family. You understand? It's when it's being used by many people in a public setting that, you know, it easily gets spoiled. But if it's being used at home, it's going to last for a long time. So getting this fig is important. Then another thing you can get is a thermometer. um This thermometer is used in measuring temperature. This one is also important. Sometimes you feel you have fever, you know, you touching yourself, whether your body is hot or touching the body of your child or your spouse or your family member, is not accurate in knowing whether somebody has fever or not. So the more accurate thing is to use a thermometer like this. This is mercury thermometer. You can get a digital thermometer. The digital thermometer works faster. This one, uh, you have to leave it for at least 4 minutes eh, for it to measure properly. This one is you put it in the axillary region, the armpits, you know, remove the clothes. You won't put it in the, I'm just demonstrating like this. You have to expose that area and put it on the skin. So you put this tip upwards, you know, then you leave it for 4 minutes for it to read properly. At the end of 4 minutes, you interpret it. You read it. You can get the digital. The digital is faster. It measures it faster and it will tell you the value. It's just that with the digital, you know, it uses battery and sometimes it can get spoiled. But this mercury type, you know, the only problem mercury type is you handle it properly so that it doesn't break. It's easy to break. So you have to get a thermometer to be sure of what your temperature is when you or your family members are sick. You know, so usually we use the threshold 37.5. So if the temperature is above 37.5, the temperature is high. The higher it goes, the more alarming it becomes and the quicker you should seek proper medical attention. So getting thermometer is important. Another thing we can get, especially if there is a family history, if there is weight, obesity, you know, and if there's family history of diabetes, if you're at risk of diabetes, if you are getting older, you of age, you can get this. This one is a glucometer. Is everything here is used in checking your blood sugar. You know, so you have the this pack has a strip. This is the strip. Then you have the glucometer device that comes with a battery. Then you have uh, lancets and other things. You know, this one, it's something especially for people who are diabetic or people who have a family history of diabetes, you know, people who are at risk of diabetes. They could get this device at home so that they can check their blood sugar. It's something that one can also get, you know, at home. and it's something that one can also plan for. You know, then there are other things too that helps with hygiene. You can get a hand sanitizer that you can move around with, especially if you go and ease yourself in a public facility. You can use a hand sanitizer if there's no soap to wash your hand. The ideal thing is to wash your hand with soap and water. It's usually better, you know. But if soap and water is not available, you can always use a hand sanitizer to quickly sanitize your hand. Getting soap and water is also important. Getting, especially if it's at home, especially you get the type that you can easily press, and get the soap out without much contact with the soap itself. It's not like bar soap. If you have bar soap, you have to rub your hand on it and keep it back. That one there's too much contact. But if you have this liquid soap, there's a container. Once you just press it, the liquid soap comes out. Then you can use it. Sanitation is something that is very important. So these are some of the things. Then this one, yeah, you may not need to get it, except if you have respiratory problem, like those that have asthma, those that are asthmatic, that can have recurrent breathing difficulty, you know, then those who may be having other respiratory difficulties as well, like COPD, chronic obstructive pulmonary disease, you know, and this one is a pulse oximeter. It's usually made for we use it in the head setting. Then you can also use it, if you have any of this chronic respiratory condition. It's something that we use. It's a pulse oximeter. It measures your oxygen saturation and also checks your pulse rate. So like this one now, you put it in the finger, leave it to the finger, then it's going to read. When it reads, it's going to tell me my pulse rate and my oxygen saturation. So this one now, my oxygen saturation is 99%, which is good. My pulse rate is 77 beats per minute. This one it's not meant for everyone. But if you having asthma, it helps to check your saturation. For somebody who is having an attack, the saturation can be on the low side, below 93%, but good saturation is above 93, 94. Like my own now is 99. So this is something that for those who have specific problems, they can get it. There are other things that asthmatic patients get. They usually get their inhaler on standby. There's one they use when they're having an attack. There's one they can use on a daily basis. Then they also have a peak flow meter. Those who can afford it can get a peak flow meter, which they can use at home to check their peak flow rate. Then this pulse oximeter can check the pulse rate. Then the pulse rate is important. If you're having high temperature, your temperature is on the high side, your pulse rate increases. There are certain conditions, certain situations where your pulse rate is high, which is called tachycardia. It indicates there are some issues, there are some problems. So that one too, you can also use it to check your pulse rate if it's on the high side. So these are some of the items you could get at home, and they can really in help us in knowing some of our vitals and seeing if there is need for us to seek quick medical attention. Then some, if you're getting to certain age where some certain chronic illness creeping, you can use it to check. Then also, if you are hypertensive, if you have high blood pressure and you're on drugs, you can also get this. Is to do self monitoring of the BP at home. but you will not use it to decide to stop drugs. Self-titration of drugs is not encouraged, but self-monitoring of the BP is encouraged. After checking it, you get a notebook, write the BP. You can check it, you know, at different times. If you check it in the evening today, another day, you can check it in the morning. You can check it at different times on different days. Then each time you check it, you record it so that when you are going to the hospital for your regular checkup, you can now go with the record. So, and another thing I would say is good to go for checkup. I've made a video on that before, okay, which I've not, okay, did I release it? I don't do. So it's good to go for checkup. If you don't have any chronic illness, you don't have hypertension, you don't have diabetes, you're not asthmatic, you don't have a heart problem and all that, as an adult, at least once a year, you go for a checkup. The checkup is to do some general check where your blood pressure will be checked, your blood sugar can be checked as well, and then you can also, depending on any situation you're in, you can also be given other checks as well. And then, there are some tests that are done at certain age. At certain age, there are some tests. For example, if you're above 40, 45, if you're above 40 years, you can be advised to be going for mammography. Like every 2 to 3 years, you do a screening mammography to screen for breast cancer. And then if you are 50 and above, you can also be advised to check for colon cancer, you know, using some specific tests. You know, then there are also tests to check for cervical cancer by doing a pap smear. There are certain age you get to. You have vaccinations that can be given. Like for cervical cancer, there is HPV vaccine, human papilloma virus vaccine. You know, so there are vaccinations that are given at certain ages. When you get into certain age, you should collect some vaccination. It's just like vaccination is given to children, and you have, boost vaccine being given at other ages. You have hepatitis B vaccine that is given, but first you have to do the test. You do the test first for hepatitis B. If you don't have hepatitis B, you go with the test results to immunization units to receive 3 courses of hepatitis B vaccine. Especially so if you are working in the health sector and you are exposed, and all that. So there are vaccinations that are given at certain ages, different ages for different vaccines for adults, you know. Then also, there are also some screening tests we do to check for certain conditions, like this BP measurement is a screening test because they are trying to screen out those that have hypertension. So when you're an adult, you get to a certain age. For every adult, at least in our own environment, at least once in a year, you should have your BP checked. Then also when you're an adult, when you have gotten to a certain age, and considering your weight, considering your family history and all that, you also have your blood sugar checked. So going for checkup is not only for when you are sick. There's checkup where you do preventive care. Preventive care, they'll give you some, you'll be asked some questions, then you'll be given some screening tests to check for certain conditions. And there are sometimes you may get to a certain age and you'll be qualified for certain vaccination, like that for HPV, which prevents the cervical cancer. There are some tests you can do, like mammography when you are above 40, and all that. Pap smear for test for cervical cancer and all that. So you ensure that you go for checkup if you don't have chronic illness at least once a year. If you have chronic illness, there's interval that you are given by your healthcare provider. Person that is saying you will give you, for example, if you are hypertensive, initially it will be every month, then two months or three months. But if you are under insurance, because of the you don't want to give so many drugs to one patient and other people won't have drugs. So health insurance patients are seen every month to get their drugs. The drugs, their hypertension drugs are covered, diabetic drug are covered. All you have to do is to pay 10%. So if you have chronic illness and you have insurance, it's once every month. But if you are paying out of pocket, it can be extended to 2 months or 3 months, depending on level of control. So as you're entering 2026, plan for a checkup if you have not done so. Then if you can afford it, you get some items at home where you can do self check of some, to check for certain conditions. And then if you are qualified for insurance, as I've mentioned before, please you go register for insurance. There's a waiting time after which it will be approved, and you can now be qualified to go to the healthcare provider you have chosen, and then to receive care. So it's not only planning that, as we're entering 2026, I'm planning to get this, I'm planning to get that. Also make plans for your health, and that is also important. So that is just the bits I want to say on this.